Welcome to The Explainer. Look, today we're tackling a massive, honestly pretty intimidating topic, but we're going to break it down so it makes absolute sense. We're looking at the 2025 trends shaping the health economy. Now, the US healthcare system is famously complicated, right? It's this tangled web of policies, payers, and providers. But instead of getting lost in all that noise, our goal today is to literally strip away the common wisdom and tear this immense complexity down into basic, undeniable truths. We are building our understanding from the ground up using a true first principles approach. And to kick things off, we really have to start with the sheer scale of the system. $4.9 trillion. That's trillion with a T. That is what the United States spent on healthcare in 2023 alone. To put that staggering number into perspective, it's 17.6% of our entire gross domestic product for the year. That is a monumental, almost mind-blowing investment of societal wealth. And it's being funded by the federal government, state programs, employers, and of course, directly out of the pockets of everyday Americans. Which naturally brings us to the absolute most important question we could possibly ask. Are we actually getting what we pay for? I mean, when you pump $4.9 trillion into a system, you expect world-class returns, right? Throughout this explainer, we are going to look very closely at those massive financial inputs and compare them directly against our actual health outputs. So, Section 1, the broken healthcare equation. Okay, let's dive into this deep mismatch between our national healthcare spending and our actual physical health, because right now, the math just doesn't add up. Here is the stark reality of our investment. Even though we are spending vastly more than our peer nations, nearly a fifth of our GDP compared to their 10 to 12%, Americans are literally living shorter lives. Our average life expectancy sits at 78.4 years, while the average and comparable OECD nations is well over 82 years. And you know, it's not just about the length of life, it's about the quality. We have significantly higher rates of avoidable mortality, meaning people are dying from conditions that absolutely could have been prevented or treated with timely care. We are spending a fortune, but we are simply not buying health. When we look at where all that money actually goes, it's a textbook example of the Pareto principle, the 80-20 rule, but playing out in extreme ways. Just look at this breakdown. The most expensive 5% of patients in the US account for a massive 49.7% of all healthcare spending. Meanwhile, the entire bottom half of the population, 50% of people, barely account for 2.8% of spending. That averages out to just $374 per person. So a tiny fraction of the population is driving massive systemic costs, which really highlights how our system is heavily skewed toward treating acute, severe illnesses rather than maintaining baseline health for the majority. And this brilliantly illustrates exactly why the system functions the way it does. The US healthcare system isn't really a single system designed for wellness. It is a Byzantine, completely inscrutable maze. It's essentially a collection of profit-seeking businesses navigating this intensely complex web of intermediaries, rebates, and backroom negotiations. The fundamental design here is built around treating illness because, frankly, that's where the margins are, rather than a comprehensive approach to actually keeping people healthy long-term. Moving on to Section 2, the affordability crisis. Now, abstract macroeconomic trillions are one thing, but how does this hit individual wallets? Let's move away from the system level and look at everyday financial realities for normal Americans. To really grasp this, we need to define a crucial, though pretty heavy term: cost desperate. These are individuals who not only lack access to quality, affordable care, but have recently been completely unable to pay for the care and medicine they desperately need. Think about the gravity of that for a second. It's not just that care is expensive, it's that it's entirely out of reach. And today, a staggering 11% of American adults fall into this devastating category. And this affordability crisis, it is accelerating fast, and it's hitting specific communities incredibly hard. When we compare the data from 2021 to 2024, we see that the inability to afford healthcare is becoming much more pronounced among underserved and minority populations. Over just those 3 years, the share of Hispanic adults categorized as cost-desperate shot up by 8%, and for Black adults, it increased by 5%. This financial barrier is rapidly accelerating and widening the gap in access to care. To ground this geographically, just notice the dark purple areas highlighting counties where the concentration of medical debt is the highest. Back in 2021, 15% of all U.S. households owed medical debt. This is definitely not an isolated issue. It stretches across the entire country, severely impacting the financial stability of millions upon millions of households. All right, Section 3, the price lottery. So, the crucial point is why? Why is this massive debt accumulating, and why is the system so incredibly unaffordable? Well, to answer that, we have to expose the wild, highly unpredictable variance in negotiated healthcare rates. Now, before we look at the numbers, you just need to know two quick acronyms: MSDRG and CPT codes. Don't worry, these are simply the standardized codes used by hospitals and insurance companies to classify and bill for exact medical procedures. I'm mentioning this right now so you know that over the next few moments, we are looking at the exact same procedures, apples to apples, when we compare these massive price differences. Nationally, commercial negotiated rates can vary by a factor of 8.5 times. Direct your attention to MSDRG 235 at the bottom there. That is a specific cardiac surgery. Depending entirely on who the payer is, the negotiated rate for that single, standardized surgery can range from roughly $39,000 all the way up to an astonishing $334,000. Think about that. It's the exact same medical need, but the price tag is literally a complete lottery. Now, what's really interesting about this slide is that this price lottery happens even inside the very same building. Looking at a standard colonoscopy down at the bottom, at MedStar Washington Hospital Center, United Healthcare pays 7 times more than Aetna for the exact same procedure performed at the exact same facility. The variation completely defies any normal economic logic. And we see this exact same dynamic over in pharmacy. U.S. brand drug prices are a shocking 422% more expensive than the average across 33 other OECD countries. To put that imbalance into perspective, the U.S. accounts for only 23.8% of global prescription volume, but because our prices are so wildly inflated, we are footing the bill for 62.4% of all global drug sales. Section 4, our worsening health. We've seen the financial toxicity, right? But how does this connect directly back to our physical reality? Let's investigate how these out-of-control costs and unpredictable prices are actually making Americans sicker. When we measure the direct population impact of medical debt on health status, the data is sobering. It shows that just a 1 percentage point increase in medical debt correlates directly with 18.3 more physically unhealthy days per 1,000 people. Worse, it correlates to 1.1 years lost to premature death. The inability to afford care isn't just a spreadsheet problem. It is a measurable physical health crisis. Because care and medicine are so expensive, people are being forced to make impossible choices. 9.2 million U.S. adults report skipping prescription doses simply to save on costs. This creates a vicious cycle. You skip your meds to save a little money today, your condition worsens, and you end up needing far more expensive acute care down the line. And just like we saw with the cost-desperate data, this forced rationing of medicine disproportionately impacts women, minorities, and low-income adults. The result of all this is clearly reflected right in our mortality rates. Despite spending $4.9 trillion, chronic diseases are accelerating drastically. Between 2018 and 2024, the mortality rate for chronic liver disease jumped by 19.1%. Stroke mortality went up 10.2%, and diabetes is up 8.5%. This is especially concerning among younger adults, where conditions like liver disease are just surging. The system is consuming vast amounts of wealth, but we are unequivocally getting sicker. Finally, Section 5, the crossroads. Let's look at how all this builds together. We've torn down the inputs, the costs, and the outputs. So what happens next for the health economy? Well, the report argues that every stakeholder in the health economy has got to return to first principles thinking. They have to strip away the noise and honestly ask, what is essential? What is the actual goal of a healthcare system? Stakeholders, especially the employers who fund 30% of this entire system, must start demanding actual value for their money. They have to rethink the very foundation of the system, prioritizing actual health outcomes over legacy business models. Because let's be real, the current trajectory is completely unsustainable. With government transparency initiatives finally shining a light on these crazy price lotteries, structural reform is coming one way or another. The source report ends with this incredibly powerful, provocative ultimatum for the industry. Do you want to implement radical, transformational change from the inside and make it happen? Or do you want to hold on to the status quo and have that change forced upon you by the government? It's a question that will absolutely define the future of American healthcare. Thank you so much for joining me for this explainer. Keep asking the big questions, and I'll see you next time.